Well, yes, good evening, everyone, to our webinar this evening. All the medication tips your doctor didn't have time to tell you. So this is going to be a really great webinar. We're so happy you're able to join us. My name is Katie. I'll be your host, and our speaker I will introduce you to in just a minute is Nanette, and she's a pharmacist, so she can share your knowledge, her knowledge with us all tonight. So should you have any technical difficulties during the broadcast, there's a number to call at the bottom of your screen to call Citrix support. The number is 1-800-263-6317. So our format includes a short presentation followed by an interactive discussion. To type in a question, use the questions section of the webinar toolbar. At the end, you'll have a chance to ask questions, so we look forward to an interactive webinar. So we know that the information you're about to hear may motivate you to make lifestyle changes, but please consult your physician before making any changes to your current routine. The Cecilia Health Certified Diabetes Care and Education Specialist will provide strategies to help you manage your diabetes. This online Q&A session is intended to give general advice. This information is not a substitute for personal medical advice and involves the professional opinion of the Cecilia Health Certified Diabetes Care and Education Specialist. So our speaker this evening is Nanette Sabel. Nanette is a pharmacist, and she has, so sorry, it's taken me a second to find it. I've lost, I apologize. It's lost from me. Oh, here we go. So sorry. Nanette's a pharmacist who left retail and became a certified diabetes care and education specialist. She's been with Cecilia Health for 7 years. In the summer, she volunteers at a diabetes camp for kids. She loves watching movies with her husband of 29 years. In addition, she enjoys quilting, spending time outside gardening, as well as bird watching. So thank you so much, Nanette, for joining us this evening and sharing with us your expertise. We really appreciate it. You may take it away.
Thank you, Katie. Thank you all for joining me this evening. Tonight's agenda, I'm going to review all the treatments for type 2 diabetes, including all oral medications, injections that are not insulin, and insulins. I'll review how and where these drugs work in the body, the recommended dosing, any advantages, the most common side effects, and any cautions or warnings. I'll also discuss how much of a decrease in your A1C you can expect with the maximum dose. Many of these medications I'll also be discussing also come in a combination form, meaning 2 or 3 medications in one pill. However, I'm only be covering the individual medications this evening. Finally, we'll briefly discuss tips on medication adherence. Now, before we begin, I want to talk about all those TV commercials you've seen for diabetes medications and how they're advertising a decrease in the chance of heart attack, stroke, or congestive heart failure. A little bit of history. In 2003, 2004, Congress approved pharmaceutical companies to advertise drugs. In 2008, the FDA mandated that drug companies that produce any medications for diabetes, type 2 diabetes, needs to also do research to prove that they don't increase the risk for heart attack or stroke. So what the pharmaceutical companies have done when they have positive information that way, they're putting that into their commercials to let people know that how much safer they could be for you. So there's many types of medications to treat type 2 diabetes. And like I said, oral medications, injections that are not insulin, and also insulins. So I'm going to start with oral medications, and this is a fancy name that represents all the different drug classes of oral diabetes medications. Each of these classes work differently from one another with regards how they lower blood sugar. And within each drug class, there can be multiple brand names and generic names, so it is confusing. So hopefully this presentation will help clear up some of this. The different drug classes of oral diabetes medications include biguanides, sulfonylureas, DPP4 inhibitors, SGL2 inhibitors, thiazolidinediones, glucosidase inhibitors, meglitinides, dopamine receptor agonists, bile acid sequestrants, and oral GLP-1 receptor agonists. So first I'm going to talk about one I'm sure you've heard of, metformin. It would go by the name brand of Glucophage, Glumetza, or Fortamet. And it was approved first in the United States in 1994 and has become the most frequently prescribed medication for diabetes. Now, metformin works mainly on the liver, and it said the average person with type 2 diabetes, that their liver releases 3 times the normal amount of sugar, and metformin helps to decrease that. And that's one of the ways it works to improve blood sugar. Now, the other way is it helps your muscles use the sugar from your blood as another way to improve your blood sugar. Now, the starting dose is recommended at 500 milligrams once a day with food and is increased over time to the maximum dose of 1,000 milligrams twice a day with food. It's recommended to be taken with the last bite of food to try and prevent the most common side effect, stomach upset. If you take it with food and you still have stomach upset, your provider can switch you to the extended release tablets. And the extended release should still be taken with food, but because it dissolves at a slower rate, you usually don't have the stomach upset. And there are multiple advantages with metformin. It's inexpensive, it doesn't cause weight gain or hypoglycemia, low blood sugar. In addition, an additional benefit is that it can decrease your cholesterol, and research has shown that metformin can have the potential to decrease the risk of a heart attack. Now, the most common side effects, which sometimes sound scarier than the actual condition, is nausea, bloating, diarrhea, headache, sometimes vitamin B12 deficiency. And if your kidney function decreases enough, metformin should be stopped. Now, metformin alone can lower your A1C by up to 2%. And if your starting A1C should be 10% and you started on metformin, once you got to the maximum dose, that would bring your A1C down to as low as 8%. Now, the recommended goal for your A1C by American Diabetes Association is below 7%. So in this case, another medication would probably be added. That said, increasing your activity and eating 3 balanced meals a day can also decrease your A1C even lower than just metformin. Oh, it looks like we have a question. I don't eat breakfast. I only eat lunch and dinner, but that's when I take my metformin. Is that okay? Well, here's my concern. Metformin only works for about 12 hours in the body. So if your lunch were, say, at 12 o'clock and your dinner was at 5 o'clock at night, then around 5 in the morning, metformin is wearing off and you're not going to have any more in your system until after lunch. So that could be about 7 hours without any benefit of metformin. And so that seems like that would cause your A1C to stay out of range. So I would recommend that you have a specific conversation with your provider and tell him, this is when I take my metformin for lunch and dinner, and that's all I take it. And either he can switch you over to the extended release that you only take it once a day, or he might say, you know, I really want you to work on having a breakfast and start taking it with your morning meal and the evening meal. But that's a great question. I'm glad you asked it, but you really need to talk to your provider about it. So now with the sulfonylureas. Now these have been around a long time too. We've had these since the 80s. And the generic names are glyburide, glipizide, and glimepiride. And they do one thing. They tell your pancreas to release more insulin. And they can be taken either once or twice a day. So the most common side effects is hypoglycemia or low blood sugar and weight gain. Hypoglycemia because if you're running late on eating or if you skip a meal, because you have extra insulin floating around, that's where you can have a low blood sugar. The other caution is if you have sulfur allergy, you may be allergic to these. And the other thing is just being on these can cause you to get a sunburn even faster. So you need to make sure in the months where the sun is up and it's warm, to have a very strong sunblock on and to reapply the sunblock often. Now, these have been found neutral for heart disease, and they can lower your A1C by up to 2%. So the next class is called DPP-4 inhibitors, or dipeptidyl peptidase 4 inhibitors. And the brand names include Januvia, Angliza, Tradjenta, and Nesina. And the people with type 2 diabetes have too much of a hormone called DPP-4. And so these medications decrease the amount of DPP-4 you have in your stomach. And by doing that, it's allowing the pancreas to release more insulin when you eat. Now, this medication also helps you feel fuller sooner, so you eat less. So it has a low risk of low blood sugar or weight gain. And this type of medication is neutral for heart disease. You only need to take it once a day, so they're simple. The most common side effects can be headache, sinus infection, and disabling joint pain. And they can lower your A1C by up to 0.8%. Now, I want to talk about side effects for a minute. And if you have side effects to any medication, you really need to let your provider know sooner rather than later. This most often can be a simple phone call or a message to your doctor letting him know what's going on. And I just don't want people to stop taking medication because of a possible side effect and going months without taking a medication until they see a doctor again. And yes, I've seen that a few times. So it's always safer to let your doctor know when it's going on instead of waiting until the next appointment. And keep in mind, there's lots of alternatives for most medications this day and age. So let's move on to the SGLT2 inhibitors, and that's sodium glucose cotransporter 2. And the brand names for this drug is Invokana, Farxiga, Jardiance, Stegletro, and the newest one, Brenzavvy, that the FDA just approved last week. In people without type 2 diabetes, when blood sugar becomes elevated around 180, the kidneys automatically start lowering blood sugar by getting rid of extra blood sugar in the urine. And with people with type 2 diabetes, that doesn't happen as well. And it usually doesn't start happening until your blood sugar is well over 200. And so by taking one of these once a day, usually in the morning, it helps your kidneys get rid of your blood sugar, get rid of extra sugar sooner rather than later. And in addition to improving blood sugar, there's no weight gain, there's even weight loss. It may help lower high blood pressure. Invokana and Jardiance may decrease the risk of heart disease, congestive heart failure. Because you have more sugar in the urinary tract, the most common side effects are bladder infections, increased urination, yeast infections. All of those are in both men and women. And there's been a few cases of diabetic ketoacidosis. Now, they can lower the A1C by up to 2%, and weight loss could be up to 3 pounds. So on to TZDs, or thiazolidinediones, and we have pioglitazone and rosiglitazone, also known as Actos and Avandia. And these help your body be more sensitive to how insulin works, and they also decrease the amount of glucose released by the liver. These can be taken with or without food. Avandia is usually taken once a day, and Actos up to 3 times a day. So with the side effects, most common is headache, sinus infection, swelling, or fluid retention. Now, if you have liver problems, this may not be the medication for you. Actos may help heart disease, There is a black box warning for both of these drugs that they can cause or worsen congestive heart failure, so weight gain and swelling should be monitored every day. And these can lower your A1C by up to 1%. So now we have acarbose and miglatol, which are glucosidase inhibitors. And they're also known as Precos and Glycet. Now, these drugs work by delaying carbs from getting absorbed from your intestine, which keeps your blood sugar lower. Now, glucosidase inhibitors are taken before meals, and you should start at the lowest dose and increase the dose every 48 weeks if needed. Slowly increasing the dose will help decrease the GI-related side effects. Weight gain and low blood sugar are the most common side effect, and when you have low blood sugar while taking one of these medications, you need to treat the episode with glucose tablets. The other treatments will not absorb fat in a fast enough manner. It's recommended that these be used cautiously if you have kidney or liver problems, and they can lower your A1C by up to 1%. The next drug is the meglitinides, and that's Prandin, which is, and we also have Starlex. These medications stimulate a rapid insulin burst, so it's important to take before a meal, so up to 3 times a day. Side effects can include low blood sugar and weight gain, and they can lower your A1C by up to 2%. Now we have Sequestrant, which is a dopamine receptor agonist, and at this point we only have one of these, and there's other reasons that they can be used for. But for type 2 diabetes, it resets our circadian rhythm to improve blood sugar control. Now, what's a circadian rhythm? According to the National Institute of General Medical Sciences, circadian rhythms are physical, mental, and behavioral changes that follow roughly a 24-hour cycle, responding primarily to light and darkness in an organism's environment. And by resetting this, you somehow get improved blood sugar control, is what we know. The exact mechanism of why this lowers your blood sugar, they're still trying to figure out. It's recommended you take it within 2 hours of waking up. Some of the possible side effects are nausea, headache, fatigue, low blood pressure, and fainting. And this can lower your A1C by up to 0.9%. And now we have one bile acid sequestrant, Welchol. And Welchol, we don't exactly know how it works to improve blood sugar. We suspect it blocks sugar absorption in the intestine. It is also approved to work to improve cholesterol. And the dose is 3 tablets in the morning and 3 tablets in the evening. And the side effects are GI related because that's where the medication is working. You wouldn't be a candidate for this medication if you have a history of bowel obstruction. It can also decrease the absorption of certain medications and vitamins, and it can lower your A1C by up to 0.5%. I just caught a note from Katie that there was a question out there that I missed, and it's regarding metformin, taking it at night with a meal or okay to take before going to bed. As long as it doesn't upset your stomach, then that should be fine. You really want to keep metformin in your system 24 hours a day to get the maximum blood sugar control. I've heard a lot of cases about stomach upset with metformin. So I'm not sure how much food you're going to need to prevent that. Everybody's different on what that means. But yeah, as long as it doesn't cause you stomach upset, that seems that would be fine. That should be fine. My concern with eating before you go in bed is, are you going to be increasing weight? But the metformin should continue to improve your blood sugar that way. So now onto the tablets that is a GLP-1 receptor agonist. And you've probably seen commercials on this. It's called Rybelsus. The generic name is semaglutide. And this increases a hormone in the gut that encourages insulin to be released when your blood sugar is high, and it can make you feel fuller sooner, which can help with weight loss. Now, it's a simple one to take once a day in the morning before food or any other medication with a small sip of water. You can lose up to 6 kilograms, which is around 12-ish pounds, and it can decrease your A1C by up to 1%. Now, something new about Rybelsus a few weeks ago is the FDA came out and said they're approving it for first-line treatment for type 2 diabetes. So for people who will be getting diagnosed with type 2 diabetes in the future, the doctors have an option in addition to metformin. They can also prescribe Rybelsus, which I think this is sort of more so allowing the insurance companies to cover Rybelsus sooner rather than later. But it is nice to have something to help with better weight loss in the beginning, rather than waiting, in my opinion. So the most common side effect is nausea, vomiting, decreased appetite, diarrhea, and headaches. And with Rybelsus, you are on a low dose, 3 milligrams for a month, and so there's not a whole lot of blood sugar benefit on that 3 milligram dose. It's really just to get your body used to having more of this hormone in your system. And then after a month, it could be increased to 7 milligrams. If you needed more blood sugar control, there is a higher dose of 14 milligrams that your doctor could increase you to. And then cardiovascular benefits, the FDA said Rybelsus reduced the risk of heart disease. And there are some contraindications with this type of medication. If you have a family history of MTC or MEN2, which is medullary thyroid carcinoma or multiple endocrine neoplasia syndrome type 2, if while you're taking it, you develop hoarseness or a throat lump develops, you need to contact your provider right away. And if you have any vision changes while you're taking this, you want to notify your provider right away as well. So now we're going to talk about the injected forms of Rybelsus. And we have weekly injections, which is Bydureon, Trulicity, and Ozempic. We have daily injections, which is Victoza, Soliqua, and Zoltrophy. And we have one injection that you inject twice a day, and that's Byetta. And these all, like the Rybelsus tablet, increase GLP-1 in the gut. So they tell your pancreas to release insulin when blood sugar is elevated. So they help you feel fuller faster, which can help with weight loss. And the most common side effects, nausea, vomiting, diarrhea, and headaches. Cardiovascular benefits, Victoza, Trulicity, and Ozempic have been shown to reduce the risk of heart disease. Bydureon, Byetta, and Adalimumab does not increase the risk of heart disease. And these have the same contraindications with MTC and M2, if you have hoarseness or throat lump develop, and with Victoza, thyroid C cell tumor concern with Victoza. So we do have a new medication to talk about, and it's called Mounjaro or tirzepatide, and Mounjaro is different because it's only one molecule, but it has all the benefits of the ones that I just got done talking about, the Trulicity, the Victoza, but it also acts like a second molecule, and that is glucose-dependent insulinotropic polypeptide. So you have the benefits of two medications in one molecule, which means it's in one pen, and they've made it simple to use. Instead of 2 drugs and 2 copays and 2 of everything, everything's in one with one molecule. Now, Mounjaro decreases how much you eat. It slows down how fast your stomach empties, which improves blood sugar another way. It decreases glucagon levels, which is another way to improve your blood sugar. It helps your body use insulin more efficiently. It can lower your A1C by up to 2.4%, and you haven't heard me say 2.4% yet. and that's one of the bigger things. It can also have weight loss up to 25 pounds. On the lower doses, it's 17 pounds. On the higher doses, people can lose up to 25 pounds. And that is good news, since most people with type 2 diabetes are overweight, and that's a very hard number to move is the weight. So like I said, it was simple to use. It's once a week. It's in a pre-filled pen. You don't see the needle. The dosing starts at 2.5 milligrams once a week as the starting dose to help your body get used to having this molecule in your system. After a month, the dose would be increased to 5 milligrams. If you need additional blood sugar benefit after that month, then the doctor can increase the dose. You can lose, like I said, up to 13% of your body weight. Side effects, nausea, and again, start with the lower dose for at least 4 weeks to decrease this one. Diarrhea and insulin site reactions, and it has the same contraindications that the GLP-1s have. Family history of MTC or men too, you can't use this. If you have the hoarseness or throat lump develop, if you have a family history of thyroid tumor. So now we're going to talk about Similin, which is an amylin mimetic injection. And amylin works together with insulin. Our bodies naturally make amylin, but people with type 2 diabetes don't make enough. And by injecting Similin before major meals, it replaces what the body isn't making. With more amylin, your liver is going to release less sugar. It's going to slow down how fast your stomach empties, which is going to improve blood sugar, and it can also help you feel fuller sooner. Side effects, nausea, headache, weight loss, and temporary loss of appetite. If you're using Similin with insulin, then you want to adjust the dose of insulin to prevent low blood sugar. The dose is between 60 to 120 microgram injections before major meals, and it can decrease your A1C by up to 0.8%. So now we're going to talk about insulins. And insulins is the most effective treatment we have for improving blood sugar. And they are in pre-filled pens and vials. We have long-acting, intermediate-acting, short-acting, rapid-acting, and ultra-rapid-acting insulin. Now here's the table of the types of insulin, and I'm going to talk about these individual groups of insulins. The long-acting Lantus, Levemir, Tresiba, Tourgeot, Basaglar. Intermediate is MPH. Short-acting regular. Rapid-acting is Novolog, Humalog, Apidra. And then the ultra-rapid-acting Fiasp, Lumajab, and Afrezza that's inhaled. So with the long-acting, or what we call basal insulin, you usually only have to inject that once a day, sometimes twice a day, and it should last for up to 24 hours. And before you had type 2 diabetes, you always had long-acting insulin floating around in the background. That's the way it's supposed to be. As we have as we have diabetes longer, that tends to dissipate sooner. And so this is usually the first insulin that people are put on, is to replace that to improve your overall blood sugar control. Now, side effects with any insulin, the risk of low blood sugar or hypoglycemia, and weight gain. Now, with the intermediate acting insulins, we have Novolin N and Humulin N, and these control fasting blood sugar and in-between meal blood sugar. One injection usually lasts about 12 hours, and you inject it usually twice a day. This is less expensive, but again, the most common side effects, low blood sugar and weight gain. So now we have short-acting insulin, which is Novolin R, Humulin R, and those are both U100. We also have a Humulin R that's U500, and yes, that's 5 times more concentrated than the other. And with the U500, people who use that tend to use it because they're already using at least 200 units of the other insulin combined. And so the U500 makes it a more convenient option. These lower blood sugars after meals. You can inject them for up to 3 times a day. And again, possibility of low blood sugar and weight gain. So now these are the bolus insulins or the rapid acting, and we have Novolog, Apidra, and Humalog, and Admelog. And these are injected 10 to 15 minutes before a meal, so up to 3 times a day. They last 4 to 5 hours for each injection. They lower the blood sugar from the food you ate, and the most common side effects, low blood sugar and weight gain. Now we have 2 ultra-rapid acting insulins, and the naturally occurring insulin that our pancreas releases is very fast. The body knows you ate insulin, or it knows that you ate carbs, it releases it, and it's done very fast. And the Fiasp and Lumajeb is trying to replicate that. So you don't have to inject these until right before you eat, like 1 to 3 minutes before you're going to eat. They last 3 to 5 hours. So they lower your blood sugar from the carbs you ate. And the most common side effect is low blood sugar and weight gain. Now we also have one ultra rapid acting insulin that's inhaled. And this is Afrezza. It comes as 4, 8, and 12 unit cartridges, and it's absorbed through the lining of the lungs. So your lung function should be assessed before you start on Afrezza. It's not meant for people who are currently smoking. If you've had any lung disease, asthma, exercise-induced asthma, COPD, you're not a candidate for this because it can cause you to have bronchospasms. Possible side effects, low blood sugar, cough, throat irritation. The cough can be prevented by having a sip of water right before and after you inhale the Afrezza. And across the board, all insulins are neutral with regard to their effect on heart disease. So now when it comes to injections, most injections for insulin, you want to inject at least 2 inches away from the belly button or the scars. You could do it on the fatty part of your back of your arm between the shoulder and the elbow. You could do it on the thighs, but you want it on either the top or the outer part. You never want to inject on the inner part, and you want to be at least 4 inches or about 1 hand's width away above the knee and 4 inches down from the top of the leg if you're going to inject there. And then you can also inject in the buttock area or the wallet area of the lower of the backside. So my suggestion for everyone is to ask the doctor for the shortest needles. And for the pre-filled pens, that would be a 4 millimeter needle. For syringes, it would be a 6 millimeter needle. And when injecting with a pen, you would inject straight in, hold it in place. If it's something like Lantus, it needs to be there for 10 seconds, so none of the insulin leaks out. You never want to share an insulin pen, and exercise may speed up the absorption. So if you're going to go play tennis, you wouldn't inject in your arm, or if you're going to go running, you wouldn't inject in your leg. And with any kind of injections, you always want to rotate your site. If you are injecting in the same spot over and over, it's really easy to develop scar tissue. And when you do that and you're injecting in there, you're not getting the full benefit of the insulin. So like it talks about, you can inject a few times on the upper right, inject on the lower right part of your abdomen, your lower left part of the abdomen, and your upper left part. And if you keep rotating there, it can help prevent buildup of scar tissue. You never want to inject where there's broken vessels or varicose veins. And they recommend to avoid injecting by tattoos as well. So it is important to take medications as prescribed, and I often find myself recommending a pill box, or they also have medication baggies that can be reused. You can you can put alarms on your phone, or put a Post-it note by either in the bathroom where you're brushing your teeth or by the coffee maker. You can keep a small amount of medication in the bathroom for morning or evening routine, but I only recommend a small amount, because if it stays in there too long with the change in temperature and the humidity in the bathroom, the medication is going to go bad, because all medication is sensitive to light and humidity and temperature. You can get a second bottle from your pharmacy with your name and medication label on it, so there's no confusion. You can also keep if you had a second bottle, keep a couple doses with you at the office, but again, with your name and label on it, so there's never any confusion of what's in there. So let's see, what questions? Oh, what do I have to do to get off of all of my medications for diabetes? Well, usually recommended to be eating a balanced meal 3 times a day with the right amount of carbs. If you're not sure what that is, work with your educator. Being active at least 30 minutes a day, at least 5 days a week. Combination that is probably going to help with weight loss, which is going to help with blood sugar control. When food and level of activity is at the correct level, there can be a less emphasis on the medication. There are people out there that manage their diabetes by being active and eating balanced meals 3 times a day. But it is something that, when you go to the doctor, what's my A1C? Is it higher than last time, or is it lower than last time? Know where your numbers are at, because if it's lower than last time, you need to know that, so you know what you're doing is helping. And if it's higher than last time, you need to know, so you know what you're doing is not helping. Work with your educator for more tips to help improve blood sugar. I heard everyone ends up on insulin. Is that true? Well, no, not everyone. But type 2 diabetes is a progressive disease, and we only have so many beta cells to make the insulin, and then they're gone. And we don't get any more beta cells. So when oral medications don't work anymore, then insulin is usually the next option. But again, insulin is the most effective drug we have to improve blood sugar. So I wouldn't recommend. It's a safe medication to take, and it's going to improve your blood sugar no matter what. Let's see. It seems like my doctor is just picking a drug for me. Is there any reason why he's choosing what drug it is? Well, there's guidelines that recommend certain drug combinations, and American Diabetes Association update these guidelines throughout the year. And endocrinologists have their own society that they recommend certain drug product choices depending on what the A1C is and what else is going on. So there usually is a reason behind it, but feel free to ask your doctor why this one, not a next one. I would expect your appointments with your provider to be more of a conversation and less of, he told me to do this. Well, that looks like that's it for questions. These are the next upcoming live events. March 7th at 6 o'clock is the Spanish version of Stop Focusing on What You Can't Eat and Learn About What You Can, Healthy Eating with Diabetes. March 14th at 6 o'clock is the English version. And in April, say no to diabetes complications, say yes to reducing your risk, keeping kidneys, nerves, and eyes healthy. And that's April 17th at 6 p.m. And thank you very much for joining us this evening. We appreciate your attendance and your participation.